For when we talk about death, for the individual that's died, we need to have kind of a common understanding. When somebody passes away, there is going to be an absence of circulatory, which is going to be a pulse. That feeling, if you've ever grabbed a pulse before, in a healthy person who is alive, you would feel a pulse. And in addition to that, there's going to be this absence of respiratory function. Those are going to be definite signs that somebody has passed away or that is dead. Thing to kind of keep in mind is that if the body is still warm, that should give you a clue that you need to initiate care. Now, initiate care should be starting CPR, starting the resuscitation measures. And when I talk about resuscitation, what I'm really discussing is that AHA CPR training that you've received. Starting those chest compressions, starting to ventilate the patient. If you don't have the ventilation available to you, or the AHA algorithm isn't available, for you to ventilate the patient, you're going to be doing chest compressions. And so if you're coming into a patient who's warm, that should be a clear indication for you to initiate care. Now, something we like to talk about with physical signs of death is this idea of hypothermia. And hypothermia is a patient who's very, very cold and their body temperature is lower than normal. If in the fact that the patient meets that criteria, say they were in a cold environment, say they were outside and it was in freezing temperatures, we're not going to be able to say that patient is dead, even though they're going to look dead, until we actually initiate care. We're going to have to rewarm them up, because what we've found is that when a patient is in a cold environment, their heart rate decreases, their metabolism decreases, and we truly don't know whether or not they truly have a heart rate, because of the fact that they're so cold and things have slowed down so much that we may not be able to feel it or see it. So in those particular patients, we're going to have to initiate care, warm them up, start that resuscitation measure, start that CPR, and until they are warmed up and we continue to see signs of death, then again, we'll reevaluate at that point and then determine that. But that's just something to kind of make note, that if you find a patient who is in hypothermia, you would need to initiate care until they're warm, and then at the point that they're still dead, then obviously you would determine they're dead. In addition to this, presumption signs of death, somebody who is unresponsive to painful stimuli is going to be, somebody that, you would suspect being dead. But it could be a patient who's, taken too many pain medication. It could be a patient who's overdosed on their medication. But these are going to add all to your big picture of your assessment. This is going to be a patient who lacks a pulse. They don't have any breath sounds when you auscultate, so that's going to be that stethoscope that we've maybe purchased, or that we're thinking about purchasing, that I'm going to teach you guys all to use. There's going to be no eye movement like you normally would see. And then last but not least, again, this is another thing that I'm going to teach you how to do if you're not familiar with how to do it. The patient's not going to have a blood pressure. When we talk about obvious signs of death, we oftentimes talk about this idea of dependent lividity. So in most EMS systems, there is going to be signs and symptoms that we're going to be looking for that automatically give us the definitive answer in the fact that their patient is dead. There's no way we're going to bring this patient back from life. And this is the idea of dependent lividity. Now, if you guys want, you could go ahead and look that up. Go ahead and Google that. You might find pictures of patients that have dependent lividity, or a patient that's died on Google, and it's kind of fascinating. I would suggest that you do that so that you kind of have an idea. But essentially what that is wherever the patient's body, the lowest part of their body lays. So whether that be a patient who is laying on their back, or say they're laying on their stomach, whichever is the lowest part. So let's take, for example, say a patient is laying forward, face forward, belly on the ground. The blood inside their vasculature, inside those tubes that are inside their body, those little veins and arteries and sort of thing, there's going to be a loss of pressure. And when there's a loss of pressure in that vasculature system, all of that fluid is going to end up leaking out of the vascular space, out of those tubes, and go to the most lowest part of the body due to gravity. And when that particular thing happens, that blood is going to rest upon that tissue or that skin and is going to create these purplish splotches that we call lividity. In addition, we're going to have this idea of profound cyanosis, or this would also be, extreme pale color looking. So white kind of presentation. And then obviously your patient is also going to be cold to the touch. They're going to be sometimes even frightening cold, but definitely cold to the touch. If you were to actually go and feel your skin currently, you would note that it doesn't feel cool, even though maybe you might be in a room that it's warm, but when you feel your skin, it's going to be warm. And so if you were to touch a patient who was cold, it's one of two things. They are clearly dead, or they're just in a cold environment and have maybe poor vasculature. So that's going to be a common sign. And as you gain more experience in feeling people's skin, you're going to develop that kind of sense of touching a patient. And when you feel that their body temperature is cool, that's going to give you a big sign that maybe something is going on. But this is definitely going to be somebody, that's not breathing, doesn't have a pulse, who's cool, who has this cyanosis all around, as well as maybe even has that dependent lividity.